March 4, 2025. I'm Dr. Deuk. We are broadcasting live spine surgery. Our patient has pain coming from the sacroiliac joints on both sides. He has injuries to his SI joints. Something happened in life. He's an active guy. We don't know when it happened, but he injured the SI joints, and now he has sacroiliac joint pain. Many people just go get shots. They'll do stem cells. They'll do steroids. They'll do therapy, cupping, acupuncture. But unfortunately, none of those treatments will actually cure the pain. There's even fusions that are done to try to cure the pain, but it doesn't work. I'm going to go ahead and numb up his skin. Henry, let's show the audience how we treat sacroiliac joint pain.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back, Sean. You can see how we treat the sacroiliac joint pain, and it is literally just a matter of destroying the pain nerves to the actual joint. Everybody has pain nerves. Not everybody has pain. He has tough fascia, Sean. There we go. That's amazing. Very strong young man, very fit, but crippled with pain, right? And that's unfortunately the story of pain. It can be crippling. Sean? Any questions?
At this moment, no current questions.
And we showed the video on how we treat SI joint pain.
Yes, we did, of course.
Sean? He wanted me to treat his facets. This will help the SI joint as well. All right, we're almost done with this SI joint on the left. Then we're going to move to the right side. I'm using an X-ray machine, Sean, called a fluoroscope or fluoroscopy to identify the targets that I need to get to. The targets are located, Sean, on the bones. The bone I'm talking about is the sacrum. You guys know what the sacrum is? The tailbone?
I do.
Yeah, you do. Does the audience?
If any respond, I'm sure they will say yes, of course.
All right. Well, the sacroiliac joint is the third most common cause of pain that's chronic, debilitating. Chronic pain is basically pain that never goes away on its own. People have to live with it for a long, long time, their whole life, until it's eliminated. The only way to eliminate pain, in my experience as a neurosurgeon, is to basically find the source and fix the source. That's what we're doing for this patient. We're going to move to his right SI joint. Let's see, hold on. Jordan, if you can help me. Sean, I need to find the right place to enter. It's interesting. He has some pelvic asymmetry, or you've got some asymmetry on your fluoro, but your spinous process looks midline. I think you're off a little on the fluoro. I think you're worse now. Go back. Actually, you're fine with that maneuver, but it's the other direction that we have an issue. Sorry, not that. Orbital. It's an orbital problem, Jordan. Orbital. Not that. Towards me. Move the head towards me or away from me. All right. Actually, that is pretty darn good. Yeah. Shot. All right. I like that. I like that view right there. And it's funny because my entry point on the tailbone is the same on the x-ray, but on the skin it's in a different location. But it may not be. Actually, his tattoo may be asymmetric. Are there any questions from our audience?
No current questions, but I personally have a question
Sure.
for SI joint pain. What activities worsen SI joint pain?
Yeah, any activity worsens the SI joint pain. The SI joint doesn't move very much. It's a joint that has a few degrees of movement, but it is the only joint where all the weight of your upper body is transmitted through the SI joint down to your hips and your legs. So basically, every bit of weight of your trunk goes through your SI joints, right and left. So it is the most weight-bearing joint of all in the lower back. That makes sense.
It does, of course.
Sean? And there's a right and a left SI joint. The right and left split the weight of the body evenly, normally, as long as you don't have much curvature of your spine. I am now treating the nerves that run from the holes right there. You guys see the hole?
Yes, we do.
Over to the SI joint.
That we do, yes.
Now remember, these are just pain nerves, sensory nerves that bring painful feelings from the joint up to your brain and really restrict your activities. They affect your quality of life tremendously. Sean? He is a very active young man and wants to remain that way, but he's completely incapacitated with the pain. Just about done. Any questions?
At this moment, no current questions.
All right. We're going to move on to the piriformises, but we'll do that as a separate stream. So thanks for joining us. You can see the incisions are tiny. I'll show you the incisions. You guys see this?
Yes, we do.
And what we do is we just do a staple a little staple, and sometimes two. You can see it's a 4 mm cut. It's tiny, okay? All right, thanks for joining us. We'll be back for our piriformis release.